So about VASER liposuction. There are different ways to do it, and typically we focus on areas of the body that can accentuate the muscle definition. So a lot of patients exercise their arms doing bicep curls and tricep presses and bench presses to try to develop their arms, but they can't really get that definition that they really want. So arm VASER high definition is for those patients who want more arm definition but just can't, no matter what they're doing in terms of exercising and lifting, etc. It also can be a good tool for patients whose skin has good elastic qualities and can bounce back, but they still just can't get rid of those isolated areas of fat within their arms. So what we do during VASER high def arm liposuction is I make a couple of small strategic holes, typically in the back of the arm, bottom of the deltoid, around the bicep, and one on the inside. And those strategic ports allow me to put in, first of all, tumescent solution, and then after the tumescent solution is in place, then I put the VASER in. Now the VASER does a couple of things. One, it melts the fat. Two, it heats the skin and causes skin contractility. And then it also aids in my dissection plane for the liposuction. It's about to start the VASER, VASER. It's an acronym for VASER Assisted Sound Energy Resonance. Basically, it's a fancy word for this probe which emits energy along the sides and helps to melt the fat. It emits sound energy, ultrasonic sound energy from the sides, which helps to melt the fat, heat the skin, and contract the skin. So I think it's one of the best devices out there. And then the third step, I come in with traditional liposuction and sculpt out the muscles. What I typically focus on is I try to develop the deltoid muscle on the shoulder to give you that nice triangular look. People call it the shoulder dip. I also develop out the bicep and the tricep and the definition between those two muscles, between the biceps and the triceps, and that specific groove between the biceps, triceps, and the deltoid. You can clearly delineate the deltoid, the biceps, and the triceps. She has the sulcus here at the inferior portion of the deltoid, nice and V-shaped. She has the sulcus between the biceps and the triceps and definitions between the muscles here around the elbow. So when patients come to me for consultation and they desire smaller arms, I talk with them at length what kind of arms they want. Now with traditional liposuction, we can get you usually smaller arms. And then with high definition VASER liposuction, we can get you very athletic arms. So I ask my patients in consultation, what kind of arm do they want? Do they want more slender feminine arms? That'd be perhaps a 1 out of 10, or very muscular athletic arms, and those would be a 10 out of 10. So we look at multiple pictures and they choose what kind of grade they want to be, and that's what I try to target for during surgery. Either feminine slender arms or very athletic muscular female arms. Typical downtime for VASER high def is about 1 to 2 weeks depending on what kind of job you do. Since VASER high def arm liposuction is a high energy procedure, by that I mean there's a lot of energy that's developed to the soft tissue, it takes a while to see the results, typically maybe 6 to 8 weeks before you see the final results.